and good evening to everybody. This is season 3, session 1. I can't believe that it's 2021. I haven't yet made a mistake, but it's 2021, and welcome to everybody who's come this evening. I think we've got an interesting evening. I hope you're going to enjoy it. I want to say a huge welcome to the series and a huge happy new year, even though it feels very difficult at the moment and a bit scary. Well, certainly there are scary bits here. And I'm going to say a big hello to the whole world. Let's not just bother with the UK. Let's say hello to the whole world, because our podcasts have been put up in the rankings, and we've got position 24 in the category of education in Gambia. So hi, Gambia. We've got position 71 in the category of education in UAE. Hi, UAE. And 191 in the category education in the United Kingdom. Now that's pretty good in Apple. So hello the world. I know we've got followers all over the place, and I hope you're going to enjoy this evening. It's a little bit different this evening. And I need to introduce myself. My name's Sue MacDonald, and I am in the happy position of being the curator of these hours and the Maternity and Midwifery festivals. And these, some of you will know, some of you new to this won't know, but these hours were really created just around the first lockdown to really provide some continuing professional development for midwives and for student midwives and other people who want to become midwives, as a way of bringing people together as well at a very difficult time. And they're very accessible, so you can be watching now. And I hope loads of you are watching now, but also in the future, so that you're able to access all of this CPD for your revalidation. Any midwives out there due their revalidation, I almost want to say, put your hands up, but I can't, because you're not going to be able to talk back to me. But if you are looking at your revalidation, check out Matflix, because this is a fantastic resource for any midwife, any student midwives. Loads of video clips, loads of information. And it's all free. And if you want it packaged, you might have to pay a small subscription, but it's worth it because it's really useful. So welcome to that. Now tonight, for those of you who usually log into the maternity hour, you know we usually have me and a couple of speakers. We're doing things a little bit differently because tonight's the first of the whole year, the new year, and we want to just have something a little bit different for that. And I'm really so pleased. I hope, see all of my friends and colleagues who are with me this evening, and welcome to them indeed. They've made time to be with us tonight. We have, and I'm going to do a very brief introduction now. If you want to know more about these glorious people, all the information's available online. But it's so we can make the most of every minute we have. Now we have Pete Walroth, and you can tell him because he's the one man. Hi, Pete. And he's the founder and chief executive of Mummy's Star. And this is the charity that he founded to support women and their families who are going through cancer during pregnancy and childbirth. And he's done a huge amount to raise awareness of this issue and has improved care and information for women and their families, but also, I would have to say, for midwives and for student midwives. He's done some fantastic work, and I'm delighted he's able to come with us this evening. Then we have Sheena Barham, OBE, who's well known to midwives and student midwives as a committed and passionate midwife, and she's helped to develop so many initiatives. If I started listing them here, I'd be here till 8 o'clock, including the Midwifery Unit Network, and she's also the director of All For Maternity and the Practicing Midwife with her daughter Anna Byram. She's also a member of the Maternity and Midwifery Forum Advisory Group, so welcome to Sheena. And then we have Manjit Rosegajini. I hope I've pronounced that correctly, Manjit. I always call him Manjit, so I never use your second name. Who is the Deputy Chief Nurse and Director of Midwifery at Croydon Health Services NHS Trust. And among her many activities, these are all people who are very busy. She worked with the RCM on a midwifery twinning project in Nepal and India, and she's done work with Rotary International to reduce maternal mortality. She's also a member of the Maternity and Midwifery Forum Advisory Group. So we like to keep her busy. And then we have Jackie Jarrod, who MBE, who is a midwife physical activity champion for Public Health England. She's a practicing midwife, and again, many of you will know Jackie from her other role as former director at the Royal College of Midwives. And she was very much then promoting the art and science of midwifery. She's now got, I have to say, she's probably got a portfolio career now, because she's into all sorts of things, but her main love, I think, would be all this activity, being an activity champ. But also she supports several charities as patron and chair, and she keeps herself very busy, and you'll hear more from Jackie in a mo. And then we have Dr. Patricia Gillen. She holds a joint post with clinical and education as a reader in nursing and midwifery research and head of research and development for nurses and midwives. And many of you will know Patricia from her work with looking into bullying, but she's done an awful lot of other work as well. But that sort of always sits in my mind, because that's such an incredible piece of work that Patricia did when not many people were looking at that. And then a little bit later, we're going to have Jenny Clark, known as Jenny the Midwife, the great proponent of skin-to-skin care, a committed midwife who's worked in all areas of midwifery, a blogger, a writer and a tweeter. And in fact, I think I would have to say most of my guests are very hot on social media. So you're going to hear more about that in a mo. And we're going to be reflecting on last year, 2020, and I know a lot of people are thinking, thank goodness it's gone. And hopefully now we can look forward to a better year and really look about what our hopes and expectations, and maybe a resolution or two might come out, I'm not sure. But that's a little bit later. I always say at this point, a point about why we've come about, which was from COVID. And of course, we're in the third lockdown now, and it's a serious and a hard time, because we have this new variant of COVID, which is very scary. The rates have become very high, and we know the NHS is under a huge amount of pressure and stress, and that kind of trickles down obviously into the maternity services, into general life anyway. So we have to, at this point, say a big thank you to all the A&E units, particularly I think the intensive and high dependency care units. They're so busy, and they're obviously tired, because they've almost not had a break all the way through. So we send our love and our thanks and our good wishes to them, and also their family, because they're doing the work as well, supporting their family member. Also, we send good wishes to patients and their families and friends, and some of those will be midwives or friends or family of midwives. So our thoughts are with you all at this point. And I'm going to send a little virtual hug and thanks to all of those who are keeping things going in maternity. And we always say, you can't stop maternity. The babies, the mums carry on getting pregnant, obviously, and babies keep on coming, and they need care and they need support. And our midwives have been absolutely fabulous this last year, absolutely fabulous, to continue providing care, and have come out with some amazingly innovative ways to make sure women feel supported and informed. So good on them. Thank you for all that you are doing, all you midwives. We're sending good thoughts to people with COVID and with long COVID, because we talked about that a few weeks ago, and that is something that's going to be with us for a while. And good wishes to anyone who's self-isolating, which is very frustrating, and those who are recovering. And a big thank you. And we were talking about this as a group a bit earlier. It's not just the people in the NHS, though they are doing a huge amount, but it's all the people who are keeping the place going for this year. And we need to say big thank you to them. So thank you to you, and big applause to you. Okay, I'm moving on. I feel like I'm galloping here, but I'm just doing a quick news alert, because of course the New Year's Honours came out, and there were some midwives in that group. And I'd like to say many congratulations to Greta Westwood of the Florence Nightingale Foundation on her CBE, Professor Hora Sultani Kabashi, Dr. Gloria Rowland, Jill Demalou and Dr. Marilyn Rogers on their MBEs, and Susan Henry and Wendy Oliwola and Dr. Mary Sheridan on their British Empire medals. That's a huge thing. And it's so lovely. It's so lovely to see midwives here getting recognised. I mean, obviously, I think everyone ought to get these medals, but it has to be to a selected few. And because I mentioned the Florence Nightingale Foundation, also, I came across the Untitled Midwifery Trust, which Jackie is chair of. And there's some fantastic awards for any of you who are looking at studying or want to do a project locally. There are 6 fantastic awards, so do go and check out what those are. Closing date's the 2nd of February, so you've got a couple of weeks. All of this information's on the resource page, so you can get that easily after the event. Of course, this the big news though the last couple of weeks has been the vaccine, which is being distributed, and it's going, thank goodness, to frontline staff, to older people, and they're working through people in a very fair and a very sensible way. And hopefully a lot of you will be getting your vaccines now. So hope you don't have any side effects. It seems as though side effects are fairly small, and it's kind of better than getting the disease. So hopefully if you have any effects, they won't be big. Anyway, go back to and check your resource page for any of the resources you're interested in. I know that our speakers will refer to a few things, so there'll be all the information's there. So I think I'll just pass on now, because I want to get as much as we can this evening. I'm going to pass to Pete Walrath, who's going to speak, and he's the founder and chief exec of Mummy Star. And I would say the screen is yours, Pete.
Thank you very much, and thank you for the lovely introduction. Well, 2020, it's a year, I think it's fair to say, that I look back on, both for myself and the team, I think, with a sense of pride, which I think might seem odd at times, given everything that we all had to contend with, both in the third sector and, you know, for all the people that we work with and get referrals from, you know, who are working on the front line. But the pride was a word that we used so many times in reflection when we think of, you know, where our mums were at the beginning of the COVID outbreak last year, and all the anxiety that they were having to contend with, the uncertainty over both cancer treatment and planned surgery, but equally for those mums who were worried about symptoms or, you know, furtherance of you know, cancers that they already had. So from our perspective, we were able to, we intensified what was already a very personalized level of support that we offer at Mummy Star, which I think is quite a unique thing in the connection that we have with all of our families, and we get to know them all really well. So we really felt as a team, you know, that running line of, you know, of anxiety that, you know, that all of our mums starts to convey very, very quickly over things like, you know, am I shielding? Am I on that list? Shouldn't I be? Shouldn't I be? I finished my treatment 3 years ago. What does that mean? And all these questions, there was an avalanche of questions. But rather than us face that and you know, be panicked, which I think for any of us working in you know, in the health sector, or directly or indirectly, I think we were all understandably could have been given a rabbit in the headlights moment with COVID. But rather than respond like that, we just ramped up the intensity of the support that we were able to offer our mums. So rather than us lose track, we started to find out even more than we'd ever known before. That then grew not only to the mums that were already in touch with us, but any new families that did get in touch throughout the year, either whether that was delayed or, you know, whether that was you know, diagnosis that was already in process at the point that, you know, the COVID outbreak you know, started. And from there, we managed to continue that level of support all year, and it made a really significant difference, because for a lot of the families, they started referring to us as, you know, one of the few constants, you know, throughout the year for them, and one of the few sources of certainty, in the sense that they knew they could get in touch with us. They knew there was somebody that would check in on them. And there was quite an amusing bit of feedback from one of our families before Christmas, where she'd fed back and said it was amazing that sometimes, you know, one of the team at Mummy Star would contact me about something that I didn't even know I was worried about yet, and, you know, what kind of sorcery was this? But, you know, as a team, it just reaffirmed to us what we had confidence in, what we were doing anyway, and that we were doing, you know, the right thing. And, you know, we shouldn't be too worried about, you know, is there more we could be doing, because we needed to really concentrate on what we were doing well already. So, from a point of uncertainty and worry, obviously as a charity within, the sector full stop, we are worried. Last year had a massive impact on us. But again, people's innovation, people thinking differently, people embracing different ways of virtual fundraising. It got taken on so much by so many different people, and people now, I think, in the future will fundraise in ways they never thought they could do 5 years ago, because they've been thrown into a way of thinking so differently. So I think in summary, 2020, it was one where we learned an awful lot as a charity, and I think a lot of people learned an awful lot about us and the different ways that you can offer an awful lot of support in a virtual setting, and it really shouldn't be undervalued. And I think we've seen an awful lot of charities echo similar sentiments across the board that we work closely with. Thinking about 2021, obviously we've started again with that level of uncertainty with this new lockdown, and obviously that does bring with it uncertainty. And especially I think my biggest concern personally would be that the news of cancer operations and planned cancer surgery starting to be cancelled within the London area, which is deeply concerning, because there is a widely held fear that that COVID is actually the tip of the iceberg of a crisis, and that the significant other that's going to come behind this is a real-time cancer crisis in the next 12 to 18 months, when all the delayed impact is felt. So we just have to manage that as best we can, and from our position as the charity we are, that is to just be there for any of those families that are newly diagnosed and that are worried. I think the flip side, though, from looking forward to 2021 and things we're looking, to get back to achieving, is the requests for our online learning and our education sessions and study days are starting to increase again after a lull of last year, because we didn't have that face-to-face time with people. So we're starting to, to get back involved with, with many student midwives, and some of the universities are starting to reach out again and wanting us to, to deliver those sessions, where even in a virtual setting towards the end of last year, the impact of those sessions was really, really quite profound for people, when we talk through various case studies. But one of the messages I was, last year I was looking forward to doing this as part of our kind of learning platform, but equally going into 2021 is, and I'm really interested to hear from all of you here tonight, but anybody who's watching, is I get an overwhelming sense of that from midwives I talk to, midwives I've met, midwives who have supported my family over the years, is we need to try and remove the word "just" when it's put in front of midwife. So often I hear so many people when I teach, when I talk to people, when I hear people referred, and I hear the words, "but I'm just the midwife." And I think there's an overwhelming sense of underplaying the importance of your own role. For us at Mummy Star, we don't see the oncologist as the most important person, or the obstetrician as the most important person. They're all important, but the kingpin in all of it for us is always the midwife, because she or he is the conduit for all the care that that any of our families do experience. So yeah, I'd say I think let's try and take the "just" away from I'm a midwife, and just make it I am the midwife, and I'm really I see my role as absolutely vital and essential to any of these families, so that we try and have that that continuity of care, and seeing the difference that that midwives really make to to the families that we care for, and and all families outside of a cancer situation as well.
Okay, that's great. Fantastic. I was just wondering if anyone, the audience, excuse me, had any questions, because that's what I apologize. That's one of the things I should have said. If anyone has any questions for any of our speakers, please do just put them through on the Facebook so that they can come through to people. And I kind of was feeling it was a very positive session, Pete. That sounds really as though you've kind of found your way with the charity, and kind of it's all been balanced. But I know that some of the discussion in the press has been about people not seeking help because they didn't want to bother anyone, or they were actually frightened of going into a hospital environment. I wondered if you'd picked up any of that.
We have, yeah. I think one of the things I think that was an issue was I think where families feel like they're potentially going to be bothering, a GP or some, or any other member that, the health community that would otherwise be part of their care, is thinking, well, there's people with, COVID that are more in need of support. And I think what unfortunately went unsaid properly for the first 2 or 3 months of the COVID outbreak last year was the NHS is still open. If you have symptoms, you must come in. And I think there's always been this myth around pregnancy, I think, with cancer, that because it's seen as this period in your life when you're, the way it's phrased crassly, you're prodded and poked more times in pregnancy than you ever will be in your life, that automatically means that therefore a cancer would be picked up. And that just, it simply isn't true. Because we know that, many symptoms are put down to the pregnancy rather than being a, potential warning sign. But I think because people didn't want to, therefore, I suppose, hang around hospital settings any longer than required. And this was the same even with people who already had cancer diagnosis. They were flying in and out of hospitals literally for the appointment and then disappearing as quickly as possible. So they sadly wouldn't have had the opportunity to see the information on the support services that are available. So we certainly did see a drop in caseload at the beginning of the year last year, probably until about June, July. But then towards the end of the year, we were back up to where we expected our caseload to be. And on that point, I mean, it's a celebratory one for us, even though we'd love to see nobody get diagnosed with cancer and pregnancy. We'll support our 1,000th family at some point this week since we began. And, while that's tragic in its own sense, that's 1,000 families that we've supported that, we know otherwise would not have received that specialized support had we not, come into being. And as tragic as it is that it took my late wife Maya's death to bring that change about, it's one that I'm forever grateful did happen, and that we did sort of make that change thanks to in a large part the midwifery community and how much they've embraced us.
Well, I mean, that is fantastic it is because you obviously wouldn't want anyone to get cancer, but to know that you've made a difference to 1,000 people is fantastic. That's wonderful. Okay. I don't know if any of my colleagues would like to address a question to Pete. You're all quite quietly sitting there.
Can I say something, Pete? I'm just really inspired by what you've done, and I just watch quietly away in the background, but feeling like my heart is brimming with gratitude to you for what you're doing, because you not only do amazing work, but you do it in such a I don't know, just such a humble way, and you make me feel really hopeful for the future, for humanity, because that very thing is in itself that you said, well, that whilst it's tragic that 1,000 women have been diagnosed with cancer, but you've actually helped those families with your fantastic charity. So I just wanted to thank you really, because the work is remarkable, and so just the way you do it is just beautiful. So thank you.
I would echo that, absolutely, Pete. It's been fantastic to see what you've achieved and what you've done for families. So round of applause, I think.
Thank you very much.
Thank you very much. Well, okay, we'll leave now. Pete's going to be slightly in the background, and we're going to, well, Sheena wheeled herself in for a minute there, so I'm going to invite Sheena to now do her little talk.
Hello, hi everybody. Hi, it's lovely to be here this evening. I've got 5 minutes, which, if anybody knows when I'm talking, 5 minutes is hardly anything, so I'm going to be really quick. But I'm delighted to be here, especially with all these wonderful colleagues of mine. So behind me, you can see there's a lovely water birth. That's Lauren Rebecca's, one of her diagrams from our Orth Maternity resources. Anyway, just to kind of say this evening, I've personally and professionally found quite a few challenges during the lockdown period. And of course, it's continuing even now. And I think the main things have been around not being able to see my family personally, and then professionally has been seeing some of my colleagues really struggling, very, very difficult. My own family have been struggling in that my daughter Anna's been working from home, and she's running programs for midwives, and she's finding it really hard with little ones to do everything. And I know that that's the same for all working mothers, that they're finding these real big difficulties. For me, it's meant that I've had to stop traveling and doing conferences around the world and speaking to different midwives, which is what I usually do. But actually, on the positive side of that, I've loved being at home, and it's meant that I've spent time with my direct family, and we had my family living with us for a while, so that was really, really special. But yeah, so and for the future, I think that the worrying things are the consequences of the financial hardships, and people living on their own, and the mental health issues that are coming up from that, and that again has affected my family personally. I've had my beautiful brother-in-law died during this period, and his funeral was non-existent, and so all these things that is kind of affecting us personally, that really have challenged all our families in a big way. But positively, I've seen communities come together, and I have personally been walking every day, doing masses of walking. And just today, it's really snowy where I live in Lancashire, and I've been slipping on the ice, and trying not to slip, skating away. And today I met a lovely man who was recovering from a brain tumour, and he was telling me how he can't work anymore, but he started doing a micro business. So I started telling him about my beautiful Nepalese daughter-in-law who started a micro business. So we just started talking because I was sliding on the ice. And so I've now connected with him, and he's connected with me. He's going to order food from my daughter-in-law, because that's what she's going to be doing now, is making Nepalese food for people. So that kind of thing maybe wouldn't have happened before, because I'm just spending time talking to people as I'm walking along. And I think that, because of the lockdown, and because I've not been going around traveling every single week to different places, the time that I would have spent traveling, I've been connecting with people online. And whilst Zoom calls aren't my favorite things, I do feel like it's tripled the amount of connections that I've made with other individuals, and hopefully being able to motivate and inspire and support my colleagues that are working within the NHS and around the world, that are working in maternity services. And because we work very closely with wonderful people like Walida, this isn't an advertisement, but it's just one of our sponsors. They've provided me with lots and lots of goodies to send out to NHS Trust, treats for midwives, treats for doctors, and all that kind of thing. So, seeing all this generosity and reciprocity to me has just been amazing. So, and I think that will continue, and I hope it will. I hope that the kindness people are showing to each other will stay for the future. And I certainly will be here trying to champion that and supporting others to kind of keep that going back to basics kind of philosophy that we've seen already. And that's all from me. Thank you so much.
Thank you, Sheena. I think that sounds lovely, and I'm jotting these things down because it's almost becoming for me a sort of a diary of kind of what you can achieve together. I think the 2021 particularly, the sort of positive things and the online learning from Pete, and now walking and talking to people. And I've got this lovely picture of you, Sheena, slipping and sliding everywhere, but still talking and engaging with people, which is what you're so fantastic at doing. And I also love the sound of the treats for staff, because I think at the moment probably all of the staff need some treats. And really the biggest thing is the kindness and the kind of gratitude and the love that we have for our staff, our NHS staff, that we almost take it for granted. And I think Pete said that earlier today about taking for granted, and some of people are reverting to that, and we need to kind of celebrate our people and celebrate our staff. So thank you for highlighting that, Sheena. That's absolutely fantastic, as always, of course. And I love the picture at the back. That's wonderful. And now I'm going to introduce our next speaker, who's Manjit, who's Deputy Chief Nurse and Director of Midwifery at Croydon. And Manjit, the screen is yours.
Thank you very much. And it's brilliant that I'm able to join you all. So firstly, I would like to say how very proud I am being a midwife and a nurse working in the NHS. And I think it was almost like Sheena's handed the baton to me. The amount of generous donations from the community, from our local community to the hospitals, that actually made a massive difference in the first lockdown. Staff really did feel appreciated, and they were working very, very long hours. Some of our staff didn't go home. They actually moved in to, they booked a room at the hotel accommodation facilities that were available in the first lockdown. So firstly, a big thank you to all the staff that work in the NHS, and in particular to our midwives, our healthcare support workers, and all key workers, because they really did keep everything going. So that's, I wanted to start off with that. So my worry in the first lockdown was I was promoted as Deputy Chief Nurse, and I was very excited in my new role, thinking actually I'll be learning the ropes of how a hospital works over the general side. And within 2 weeks, we had gone down into full lockdown. And our chief nurse, who is very, very supportive, took on the role as the senior responsible officer for COVID-19. So I was left with as business as usual for the rest of the hospital. So it was a massive learning curve. But what was remarkable was how all the teams pulled together. And it didn't matter whether you were brand new or you were in the system for many, many years, all the staff did pull together. There was a point where staff were asked to be redeployed, where community services were shut down, closed down. So thinking about our health visiting colleagues. So basically they had less than 3 days notice. They were informed that they weren't doing community clinics because of the lockdown, and they needed to come in to support the general side. So just thinking about that, just holding that thought of how scary that must have been for staff being redeployed to an area that they're not familiar with. But boy, did they really step up to the challenge. And we had over 30 staff coming in from the community and helping on the general wards. The other success story, which was remarkable, was we had BA staff, so British Airways staff, because they were furloughed or waiting to be made redundant. They offered their services and worked in NHS hospitals. And we had over, I think it was probably over 35 cabin crew who came and helped, firstly as volunteers and then became paid workers. And we've now actually employed some of those BA staff. We've got 5 BA crew who no longer work for BA, but actually are maternity support workers. So I think that's another success story. And they really have made a difference. So again, I thank not only the key workers, but actually people working in the travel industry. They really did step up to the mark. The most difficult experience, I'll try to hold it together, for me was actually the visiting. And I know that's very, very topical, especially for maternity, where because of the lockdown, people who, patients in hospital were unable to have visitors to begin with. And I looked after, she was actually a member of staff. Her husband was actually dying. And the question was asked whether she could go in and say her last goodbye. So that was a real, real tough period of time. And of course, the consultant in intensive care actually said, why not? So that member of staff wife was actually did go into say goodbye in full PPE. And I'm so proud that, you know, that decision making, you know, was facilitated for that patient and his wife. And really reflecting on that, during the first lockdown, I know the previous speaker talked about, Sheena actually, about funerals. So recently I've attended one of my friend's funerals, and it was very therapeutic. It was just coming into the third lockdown and able to attend a funeral to say goodbye to your loved ones and supporting friends and family. You know, it almost felt like full circle within the COVID time. So moving forward on what I'm really excited about is our hospital was one of the 50 hubs for the vaccination. And I'm very pleased to tell you that the vaccine was rolled out in our hospital well over 4 weeks ago. And I think Sue had mentioned earlier on, you know, there is categories on who should be having the vaccine first. So over 80, our patients were over 80, they were invited in. But because of the way the vaccine is made up, we need to make sure that no vaccine is wasted. So all staff who are in the high risk category could put themselves forward for the vaccination, and that is how the programme is rolled out. Having said that, there is also an opportunity for any member of staff who would like the vaccination towards the end of the day where vaccinations are still available, so we're not wasting any vaccinations. And I'm very pleased to tell you and share with you that I have actually had my COVID-19 vaccination, not only my first one, but I've actually completed the second dose a couple of days ago. And I was really, really pleased that that was on offer at the Trust. And I'm feeling fit and healthy and really looking forward for the end of this lockdown and new hopes of, you know, the majority of people being vaccinated and that we really get past COVID-19. I'm going to stop there. Happy to take questions.
That's fantastic, Manjit. Thank you so much. And it's so lovely to hear that you've gone the whole story and actually illustrating having the vaccination and how it's being done on the ground, which is fantastic. Because I think sometimes when you're listening to the radio, you might think nothing's going on anywhere, and are the staff okay? And that's lovely. It's just so lovely to hear. So thank you for that so much, Manjit. I do have some questions. Actually, at the moment, they're for Pete. But if we finish so far, and then we go back to the questions. So anyone who's listening or watching, we will get to the questions. Okay, so our next speaker is Jackie Jarrod, MBE, NHS midwife, and our champion for physical activity. So welcome, Jackie, and the screen is yours now.
More stable connection now.
Okay, thank you. I've just been having some intermittent internet connections, but my tech support has sorted me out. So I just want to check, is everything okay? Can you see and hear me? Thank goodness for that. My goodness, he's put some sort of a cable in. It's like an umbilical cord. But anyway, I seem to be secure. And breathe. Okay. So, like my life is normally, my 2020 was a bit of a roller coaster year. I'm really pleased to say there were more sort of best points than there were sort of worst points, but there's one really, really dreadful point in my life in 2020 during lockdown when I very sadly lost my mum. But the horrendous thing was that mum lived in Glasgow and I was in Yorkshire, and there was just no way that I was allowed to visit. She was in a care home. So that for me it's taken a lot of time to work through. Not sure if I'll ever work through it completely, but I'm getting there, I have to say. But it just made me think about the people that have been through this terrible disaster. When we see the figures go up every single day, we get reports and they're reported as data and statistics. It just breaks my heart, because that is either somebody's mum, father, sister, cousin, wife, daughter, whatever. And the statistics don't really equate to how it actually feels. But when you think about those large numbers, I really get it. So that just was the worst thing that's probably ever happened in my life, I have to say. At a professional level, the low point in 2020 was I got really excited and geared up to this new role, the Public Health England Physical Activity Clinical Champion. Now that's a bit of a mouthful, and I know it's sort of, you know, goodness me, what does it mean? But basically you're a trainer. So basically, you know, you're a qualified registered healthcare professional that goes out to the NHS trusts and trains doctors, nurses, midwives, GPs, etc., allied healthcare professionals about how to have conversations and the data behind the reason why we've got such poorly people in this country and why we've got long-term conditions and what we can do to keep people active and keep people moving. And we're sort of really careful that we talk about activity and not exercise, because the minute you start to say you've got to exercise, people kind of switch off. So that's really, in a nutshell, what we do is physical activity clinical champions. So I got all geared up, got the interview in January, started the role in February, went into lockdown in March, and that at a professional level was just absolutely horrendous. However, you know, we were put on standby, we were kind of stood down, but you know, we could have conversations with people to say, this is what we're doing when we're out of lockdown, and perhaps we can start, you know, we can come into your organisation. So things didn't completely stop, but we continued to sort of do little pieces of work with Public Health England. And the nice thing was I got into the webinars and so on, and I got some of the inside news on what was happening next and what the, you know, what Public Health England were up to in terms of, you know, the testing and so on and so forth. So that was nice, and I met some lovely new colleagues, so that was wonderful. One of the best points, being a midwife for 40 years plus, well, healthcare professional, nurse at first and then midwife, was having time, a bit like Sheena said, having that time to catch up with my immediate family, my wee sort of family in my own wee hub sort of at home, not going out to meet anybody else, but actually going out with them for a walk or a cycle or a run or whatever. And that was a real high point, because I hadn't been able to do that in over 40 years. Maybe sometimes on holiday, but on a regular basis. So that really was good. And also being able to meet up with another person outside, i.e. my personal trainer, to be able to continue and doing personal training at social distance, either in a park or, you know, in a garden, his garden or my garden. So that really, being a physical activity sort of passionate person, that was really good, because I think you've got to role model what you preach. Out of all this sort of dire COVID messages last year that we were getting from government, and you know, all of the downs and the ups, one of the most positive things that I took from those briefings, those television things, was when we had Professor Chris Whitty by Boris Johnson's side, making sure and ensuring that physical activity was at the top of the agenda. He was absolutely adamant that this was not going to get lost. He had done some work with the other 3 chief medical officers in the other countries to come up with some infographics, 2017 right up to refreshing them in 2019. And I think that was a really exciting point for me, because it meant so much to me at a personal level, being passionate about activity, but it was giving the message out to the whole nation that we could still get out there and do our activity in a socially distanced and safe way. So I think, you know, I really took that to heart. I loved it. And I actually found myself doing, I mean, people here will have seen them because they commented on Twitter. I took myself onto Twitter, made little videos and got some pots and pans and done some exercises using them as resistance weights, or like a Le Creuset big heavy soup pan, and doing some sort of kettlebell sort of swings and squats and so on. And tagged in Sport England, tagged in colleagues, tagged in This Girl Can, This Mum Moves. And one of the highlights was getting retweeted by Le Creuset. I thought that was just so amazing. Le Creuset thought I was promoting their pants. I was not. I was just actually using them as a, you know, as a kind of a kettlebell sort of thing. So, but yeah, that was funny. So, the other highlight was I actually saw my son, who lives in Bristol, at Christmas. So, I mean, what a big journey he made, you know, just for a matter of a short period of time. But he actually got up here within the window, and that was a bonus seeing him, because I never thought I'd see him until goodness knows when. My hopes for 2021 as a physical activity clinical champion, there goes that mouthful. We just call them PACs actually in the business. My tech support's just, so I'm giving them the thumbs up, checking my internet is okay. I also, you know, I've got a wee fitness qualification, a wee level 2 sort of fitness instructor, which one day I'm going to go into that village hall and I'm going to teach women how to do squats, lunges, pelvic muscle control and so on. But so that's one of my ambitions for 2021. But I'm really looking forward to restarting my PAC role and to share my passion and knowledge about the importance of activity in the healthcare role, because we've all got a window of opportunity. You can have a 1 minute, a 3 minute, a 5 minute conversation about how did you get here today? Did you walk? Did you take the bus? Or you brought the car? Or why not park it further down and try walking? That might, you know, help you in terms of, you know, being a little bit more active. So it's not all gone flat. It's started to build up again. And just as we've started to build up these online sessions where we're doing it via Zoom. Microsoft Teams, and I am not the best person on technology, but I'm getting there slowly, and I always have my wee sort of tech support in my pocket, even if I have to phone him at work. Really looking forward to this taking off again in 2021 post-lockdown, but also in the meantime trying to have the conversations again with people and trying to get some dates for further down the line. I think I'm going to try now and share my screen. I think sort of we've got to all, as midwives, healthcare professionals, support workers, we can all have this conversation with women. And the CMOs have given us some beautiful infographics. Here we go. There we go. Can we see that? Okay. So, I mean, I don't know how many people out there have not only seen these, but have actually used them. They're really simple. They're really clear. They can actually spell out to the healthcare professionals and to the women what it is that's going to help them to keep active. And there's an awful lot of myths out there about, you know, it's not safe to be active while you're pregnant. It's not safe post-birth. It absolutely is. If the women are straightforward, no complications, she can keep active, and it's really important that we encourage every woman to keep active. We are aiming at 150 minutes per week, and that's women who are physically active in pregnancy and for women postpartum. Now, the postpartum women, you wouldn't obviously say 6 hours after birth, get out there and do a walk or get out there and be active. It's about when the woman feels okay post-birth, she should start being active and aim at 150 minutes per week. And the infographics are really user-friendly. We've now had midwives and GPs actually print, and health visitors as well, print these off and stick them in their clinic rooms, and people are sort of able to access them. So that is a really sort of positive tool that we could use. And I get really excited when I sort of look at these and sort of share them with midwives. I think one of the most important reasons behind this clinical champion initiative is the fact that we've got such a big problem in this country. And in this country, we have got adults who are 20% less active today than they were in the 1960s. Now, I'm sure people like Pete and Sue who run, and Shane and so on, people out there will think that's absolutely amazing, because wherever you look, people are going to gyms when there's no lockdown. People are out there running, cycling, but the actual truth of the matter is we are less active, and by 2030 it's estimated that we're going to be even less inactive, 35%. Physical inactivity causes 1 in 6 United Kingdom deaths and 40% of long-term conditions. So you can see that we've got a problem, and the cost of that to the NHS is £7.4 billion. So just think what that money could be used for. I'm going to move on to my next wee slide if I can. Midwives and women, healthcare professionals, and anybody can actually access an awful lot of resources online. But this is one of my favourite, Active Pregnancy Foundation. Now, they're a fairly new charity. They've been going for just over a year. I happen to be part of their scientific advisory group as a midwife, and they have got some amazing resources. And this is one of my favourite. They've got top tips for women, for partners, for midwives, for any healthcare professionals that they can actually access and have a wee look at. And it's just really simple messages about how you can stay active during lockdown and when you're in tears or when you're sort of, you know, in normal times. And it's really simple things like that. The messages are simply combining activity with something that you already do. So if you walk your dog, you know, walk the dog a little bit further, take the children with you, take the new baby out in the pram, push the baby around, show the baby off, wrap the baby in the kanga, walk around the house with the kanga and the baby. Just keep active. When women are going shopping, try and shop local, leave the car at home, walk to the local sort of supermarket, etc. And when you're playing with your baby, do something that we call tummy time, you know, do some little exercise. Because if we start doing activity with a newborn, just think when you bring that baby through to toddlerhood, then to you know, infants and so on and so forth, it's going to become a natural part of its life, and that makes the future look really bright and really positive. And one of the most important things that you can do is dance in the kitchen, dance when you're cooking, dance when you're, you know, having, that is classed as activity. follow the TikToks, do the TikTok dances, etc., which we were all talking about a little bit earlier. But the message is that we have got to encourage everybody. It doesn't matter who you are, particularly women who are pregnant and postpartum. We want to keep everybody active. And in the seniors and the older generation, we can help them to keep active, even if they can't move very much. We can do sort of upper body if they're sitting down a lot, and we can do little leg exercises. So positivity for 2021 is keeping active, and I'm really looking forward to being part of that. Thank you.
That's great. Thank you so much, Jackie. That's lovely. I'm just thinking 150 minutes, that could be for all of us as well. It's not just for pregnant and child and partners and midwives and student midwives.
That's right. So the normal adult population
Exactly.
is expected to do 100, and the infographics actually stretch to all of them. And we've got infographics for toddlers and infographics for people with physical disabilities, etc. So you're absolutely right. It is 150
Fabulous.
minutes for everybody.
Well, there's just so the audience knows, there's all these links that Jackie's talked about are online on the little resource sheet. So they'd be really useful. And if you want to try something like the couch to 5K, which I've been doing for months actually, but that, you know, I'm getting up to my 25 minutes running now, and it can be done. So good luck, and thank you, Jackie, for that session. This hour's going so quickly, and I must now quickly bring in Patricia Gillen, because otherwise we'll run out of time. So, and Patricia's come in from Northern Ireland, and I think the screen is yours.
Oh, it shouldn't be.
Oops.
Why? I wonder. Don't know why. Okay. I keep getting told that I'm muted, but hopefully not. Hopefully you can hear me. Delighted to be here, as Sue has said, and I'm here to talk to you about some research. And I think, as was said at the very beginning, I am passionate about looking after our staff. Having been bullied as a midwife, having left my job as a result of being bullied, I have remained passionate about how we need to look after each other, how we need to care for ourselves and each other. And any opportunity to look at the culture of work, to look at how we can care for our staff, what about the well-being of our staff, I'm in there. I'm delighted. So last year, I had started to work with a group of colleagues. They're from a range of universities across the UK. There's ourselves at Ulster, Queen's University in Belfast, Bath Spa University, King's College in London. And it was just about bringing us together, social workers, nurses, midwives, human resource people, business people, you know, bringing us all together with a passion for the same topic. And we were going to look at how to keep people healthy while aging at work. And then COVID appeared. And we thought, well, okay, actually, this is going to be one of the greatest challenges to our health and social care staff. Let's see if we can look at that. So that's where we started in 2020. And you can see from this, what we were aiming to do was look at the impact of providing health and social care during COVID-19 on nurses, midwives, allied health professionals, social care workers, and social workers. And we were focused in, we started off really quickly. I mean, we really only started talking about this in March, April, and we were running the survey in May. So it all happened very quickly. It was rather mad, rather fast, but it felt very much like the pace that was happening with COVID. It was really gathering momentum very quickly, and things were changing very quickly for everybody. So we looked at, clearly demographics are very important, and we also use some clearly validated scales such as the short work Edinburgh mental wellbeing scale, the quality of life scale, the brief cope scale, which looks at the coping mechanisms that people will use. But also very importantly, we also used the Clark et al. Coping with work and family stressors scale, because it became very clear very quickly that actually people were having to grapple with not just work, but being at home working, having to maybe be furloughed, be out of a job, lots of challenges that they didn't ordinarily have. Now, across the UK, we had 3,290 responses. That may not seem like a lot, but given the challenges that we were dealing with, we were pleased with that. It gave us quite a good overview of what was happening. The respondents were mostly female, the age bracket was 30 to 59. Among midwives, the age bracket was 30 to 49, so a slightly different lower demographic. Most of the respondents were in band 6. We did get a lot of respondents in band 2, 3 upwards. You know, there was quite a range. Most worked in the community. That's for the general population right across all of the professions. Within midwifery, most of the midwives that responded worked in hospitals. And then some in the community, and the remainder between the hospital and the community. There were a number of key findings, and we sort of grouped them together just to try and help us look and see what were we finding. And very clearly what was bouncing out at us were changing conditions, the fact that people were having to deal with the whole safety aspects, the work routines, working from home, working different shifts, working in different environments, the redeployments issues, which were mentioned earlier. The work intensity, working too much and working too little was quite interesting. That came up as an issue as well. And then that very important work-home life balance and having to sometimes have work at home when people weren't used to having that, and dealing with children and schooling and all those great challenges, and perhaps also increased caring responsibilities to add into the mix. So quite a lot. The connections, it's clear, someone mentioned earlier about the connections and the importance of those connections and how we all had to become very used to connecting with each other in different ways. And that was for just not only with employers, but also with our service users and also with the public generally. And some of that we did actually ask a clap for carers question, but we'll talk a little bit more about that later. And communication, it was interesting that people felt communication was so important. I mean, we always talk about it being a soft skill, whereas I think communication is a vital skill. And it was really important that, you know, people felt that it was so important that the information that they got was right. And people did say that at times they got really contradictory information. They were given vast volumes of information, expected to wade through it and make sense of it. And it was very challenging for them. Whereas for some people, they actually found that they were very well supported. They were given key information, timely manner, and it worked very well for them. So there was lots of ranges of responses received. There was a sense of isolation for many, and I know that that was right across the age, the demographics, right? You know, whether you were working in healthcare, it didn't matter whether you're old or young, quite a few people suffer from that sense of isolation because there was that lack of connectedness, and that came through very strongly. Also, there was some frustration and demoralization, and that was to do with the lack of resources, to do with the challenges of working hard and not doing enough, about never seeming to get it right. So here are some of the responses directly from our respondents, and I'll let you read them for yourself. And Sue, I think has shared the presentation, so you can have a look at those. And within the presentation at the very end, there's a link to the website, and the full report is there. And it is accessible, and you can look at more detail on a lot of the information that I can't talk to you about tonight. I think the connections were really important. As I said, really people were very worried about the service users. It didn't matter whether you were nurse, midwife, AHP, social worker, didn't matter who you were worried about the lack of connection with them, the fact that you didn't have that normal relationship that you had with them. People felt that they were, you know, worried about what's happening with those people when we're not connecting with them. And that was good to see. It was quite altruistic. It wasn't just about them as healthcare workers being stressed and under pressure. They were very worried about the health and well-being of the service users that they normally connected with. And as you'd see, one of the midwives in Wales was saying about the women changing their patterns of care because they didn't want to go to the big district hospitals anymore. They want to be seen more locally from a safety perspective. And that came across very clearly in lots of instances, not just for women. From the changing condition point of view, there was that issue about for the actual healthcare workers about being redeployed and the challenges and the stress of that, and that's already been mentioned. And that idea about safety, the whole idea at the very beginning where there were the challenges with getting access to PPE, appropriate PPE. You know, I even had my own experiences of having masks that had the expiration dates. If you a new expiration date put on top of the old expiration date, and you were thinking, is this safe? Is this right? Should I be wearing this? Is this going to protect me? All of these things that people were going through. we received some of the response talked about that very much, that contradictory information about not really knowing what they're being told and not feeling supported. Others felt very clearly supported, very clearly felt that their managers were doing everything that they could for them. And it was about good communication styles. It was about understanding their staff and what their needs were. So how did our staff cope? How did our health and social care staff cope? Well, across all of the professions, there really was a very strong move for active coping, very positive coping mechanisms. People did they accepted things, they tried to positively reframe things, and they tried to plan and really find humour. Actually, humour came out quite strongly as well. And nurses in particular, they scored highly on venting, and I laughed when that came out of the figures. The AHP scored higher in religion. Midwives scored quite high across all those very positive reframing, planning, being organised, accepting, getting on with it. And from a wellbeing point of view, it's interesting, the total wellbeing score of the respondents came out at 20.95, and that's about 2 points below the general wellbeing score of the general population. So for health and social care workers, there is that little drop in their actual well-being score. So that's something to be considered and thought about. And I suppose bring in the physical activity bit of that Jackie was talking about, and that may help address that. From an active coping point of view, clearly use of emotional support, recreation and relaxation, work-family segmentation, so getting that right, did predict higher work-related quality of life. So where you got your coping strategies right, where you used those very positive coping strategies, it did impact on how you felt about your work-life balance. There were no overall differences between occupational groups, age, gender or ethnicity. Response from Northern Ireland and Scotland had lower work-related quality of life scores. Doesn't quite surprise me, but there you go. Having a disability and reporting sickness in the past 12 months predicted a lower work-related quality of life score, which is not necessarily surprising. And interestingly, for employers, a lack of preparedness for redeployment, so people feeling that they weren't properly prepared for that redeployment, did impact negatively on people's work-related quality of life. So looking forward, and as I've said, this is quite a run through, there's a lot more to it. It came out very clearly that the employers needed to provide flexibility around working hours and location. And there were many of the respondents who said that had worked very well for them. There were some who said it hadn't worked so well. Some staff were keen for more involvement, decision-making and autonomy. Some felt they were left out of the loop, they were being done to, as opposed to done with. Connection with colleagues and managers was very important for many of our respondents, and that could be done in any way. And the visibility of management, either in person or virtually, was also seen to be really important. Skills training and preparation for redeployment, as I've said, that's really important one for employers to consider, trying to preempt that idea about redeployment, trying to anticipate what do we need to put in place. I know that's sometimes not possible. And then that general health and safety at work. As I've said at the very beginning, the PPE may have been an issue. I think there are a lot less issues with that now. Well-being and taking leave. It was important that however busy things were, where possible, people needed to have their breaks and to have break away from work and to have their leave. So that was really important. So that brings me to the end, a very quick fly through. Looking forward to this year, we're actually in the middle of our next survey. So anyone who still who would like to take part, we'd be delighted. Whether you're a nurse, a midwife, AHP, social care worker or social worker, very welcome. The link's there. I know Sue has put them up on the site as well. And we did get the survey translated into Welsh as well. So it is available there in Welsh. And the HSC Workforce Study website is there, and you can get the full reports there. And we have already undertaken some focus groups to follow up with managers, and we're doing next week, I'm doing some with frontline staff. If you'd like to get involved in that as well, please feel free. Thanks so much.
That's fantastic, Patricia. Gosh, edited highlights.
Absolutely.
So and anyone who's been involved in any research will know that Patricia was set a difficult task to just sum it all up. But of course, one of the important things is to look at the research yourself, have a look, share with your colleagues, but also look at whether you want to be involved in the next bit of it, which is really important as well. So thank you so much, Patricia, for sharing that.
Thank you.
I think I might have another invitation for you coming along. Now, I know that we're very short on time now, and I've had a couple of questions from the audience. One is from Mala, who's quite often comes, so hi Mila, and another one from Susan Vining, who also is someone who comes a lot. And both of them want to know more about Mummy Star. So I think if I can ask Pete to maybe answer this online afterwards, I think that might work better.
No problem.
And I hope that's okay with everyone. I think there's a few questions coming about the vaccine, but I think that will need to be online because we have run out of time. And I wanted really to also highlight the top 10 Maternity and Midwifery Hour episodes, and just say to you, they're on the website as well. Worth going to see if you can see if you've seen all of the sessions. So the top one is COVID-19 and infant feeding. And the second one down is midwifery students stepping up. Sickle cell and blood disorders is number 3. And 4 is dismantling racism and inequalities in midwifery education. So there's a really good sample of things. And in fact, I wouldn't be able to choose my favourite because they've all been fantastic. And this evening has been fantastic as well. I've been so honoured to have my colleagues here sharing their knowledge and their skills. I set them a difficult task, which was very mean. I'm sorry. I'm going to finish off with Jenny Clark, who is going to finish with something rather nice. And then afterwards, I'll say goodbye and all the rest of it. So Jenny, the screen is yours.
Oh, good evening, everybody. I wrote this poem actually well before lockdown, when I'd finished a night shift and I was looking out of my window and it was early morning and the sun was just coming up. And it still gets me a bit emotional, so I hope it doesn't get you too emotional. I hope you feel positive at the end of it. So I'm going to read it now. It's called Skybird. I gazed out of my window straight ahead at the morning sky. A beautiful golden flicker caught my eye. A single white bird ascending into the sun of dawn made me stop my worrying, become mindful and less forlorn. Its wings reflected the golden sun on every downward swoop. I couldn't stop staring. I felt my heart go whoop. This bird, it worked so hard to rise, then glided gently down. The moment helped me switch off my mind. I lost my concerned frown. I felt at one with nature. Time so still and quiet did stand. I wanted it to last forever. Imagine myself above the land. So if you're ever feeling anxious and you're not sure what to do, seek out a gliding skybird and the answer might come to you.
Oh, Jenny, that's wonderful. Thank you so much. I can see that bird now. It's absolutely fabulous.
Oh, thank you.
And like every other evening, I can't decide now, definitely never a favourite. I think this evening has been fantastic. There's been such a lot of information and sharing, and your thoughts and your emotions and hearts have been with us, and I've been very honoured that you've joined us all. So thank you very much to our wonderful, wonderful speakers, Patricia, Jackie, Jenny, Manjit, Pete and Sheena. And thank you very much for coming to be with us. And to our audience, don't forget it's the Midwifery and Maternity Festival next week. So that we will be doing sort of edited highlights in the evening. And the All Ireland Festival is on the 9th of February. I think in the meantime, I think on behalf of us all, please stay safe, take care of yourselves. I'm sending a virtual hug to all of you. Stay safe and love your loved ones. See you next week.
Oh, thank you. Take care, everybody.